Hello everyone, this is Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I wanted to talk to you about my most favorite skin tightening, skin lifting procedure, which is FDA approved, and it's called Ultherapy. What I really like about it is that it is completely non-invasive. There is absolutely no recovery time to the patient at all. Some of our laser procedures, for example, will cause some redness and swelling initially, but with the Ultherapy we actually don't see any swelling, we don't see any redness really for any substantial amount of time, maybe a little bit of pinkness for 30 minutes or so afterwards. And patients usually notice somewhat of an immediate tightening effect, and then the procedure continues to work over time, and we see the maximum results at about 4 to 6 months after the procedure is completed. Most of our patients are coming in for additional treatment, so we're seeing them back even a few weeks later or a month later, and they start telling us how much of a difference they're already seeing, and that gets us excited because we love procedures that make a definite change and difference. And Ultherapy is one of those procedures that is just extremely consistent across the board. We rarely see it fail in any patient, and I'll explain to you the science for how it works a little bit so you can understand why it works so well and why it has continued to be our top performing procedure that I like to recommend. Ultherapy is also really excellent not just for the face, and of course this is the #1 complaint I feel women come in with is their jowls and their neck, and it's just starting to look old, but they don't want to have plastic surgery necessarily. And if you start a procedure like Ultherapy at a younger age, even like in your 30s, when you're just starting to notice some of that drooping and sagging occurring, you will see great benefits, and then continue doing it every few years to maintain that tissue. And I'll show you exactly what it does and how it works and why you should keep doing that. But I was saying, the procedure is excellent for the face and neck, but also really great for the chest, especially where patients develop those crepey lines between the breasts. And also for, we have seen amazing results, and more importantly, our patients have been loving the results for off-the-body Ultherapy, including that crepey skin on the arms, by the elbows, around the knees, the stomach area. Post-baby bellies do great with this, and then also the area around the thighs and the buttocks. So Ultherapy uses what we call focused ultrasound. So this is not the ultrasound you get when you have a baby, but it is a high-intensity energy ultrasound that penetrates through the skin and is able to specifically target tissue. And that's what makes it a bit more unique than, let's say, a radiofrequency procedure which heats the skin, but we cannot tell exactly how deep that energy is necessarily penetrating. What's unique with Ultherapy is that there is actually an image that's displayed on the screen showing the different layers of the skin and exactly where that energy is going. So similar to a facelift, let me show you this image here, if we can zoom in on this a little bit. So if you take a look at the radiofrequency procedures I was just talking about, they're able to heat deep into the dermis, and that heating effect causes the skin to react and respond, and it starts making new collagen fibers and elastin fibers, which we actually lose as we age. Lasers are great for a more superficial improvement in fine lines and wrinkles, pigmentation, blood vessels, and that sort of thing. And then a surgical facelift is where the skin is lifted up, and then this tissue here, which we call the SMAS, is sutured. Now with Ultherapy, it's about the only procedure that will go through the skin and target that exact same tissue that is lifted during a facelift, called the SMAS. And then we will also do another pass to help stimulate collagen in the dermal layers of the skin. So that is how the Ultherapy works, and that's why it is unique and able to give us that skin lifting effect, which we don't always see with the other procedures. These are the different parts of the um, face that we treat with the Ultherapy. The neck being very popular, of course, the chin area, the cheeks, around the mouth, and around the eyes. Now, around the eyes, Ultherapy will give a really nice brow lift, and that is always a very nice wow effect. And I actually really love it for the lip area too, because it helps with those fine lines and those wrinkles around that area. So, this is a visual of what is actually displayed on the screen during an Ultherapy procedure. So again, it shows the different layers of the skin, and then the different lines indicate the different transducers that can be used during the procedure, and each one penetrates to a different depth. So depending on where the tissue is, the correct transducer can be chosen to target the target tissue essentially. And that's what makes it, again, just so specific and so targeted. And that's why there is no collateral side effect or damage to other tissues. And the results are, like I said, really consistent across the board. These are some before and after photos showing an improvement in the chin area and a straighter jawline. This is an example showing a little younger patient and a little older patient. Again, a very dramatic before and after result. These are examples of eye lifts where the brows can go up several millimeters to give a more open appearance to the brows. These are some more examples of the lower face, which is the most commonly requested area. Although I will say that most patients choose to treat the entire face and neck, and then sometimes also include their chest to get a more comprehensive treatment. Some more examples of the neck. And would also like to show you some results on the chest. So here's an example of a chest. And you can see the improvement in the skin quality along with the reduction in the lines. So again, like I said, this is my most favorite procedure because it is completely non-invasive. There is zero recovery time. You can walk out of the office and go to a social event or function immediately afterwards and get nice results, really nice results that continue to get better and better over 4 to 6 months. And all of your friends will be asking you, what did you have done? What's going on with you? And we hear that repeatedly from our patients, and that's what gets us excited. We just want you to be happy and get awesome results, and we're here to help you. And as soon as we reopen, we'd love to see you here. Thank you, and be safe, be well. Thank you. Have a great day.